Hello, everyone, and welcome to Stories of Care, the podcast that covers infection prevention and healthcare equity. Today, I'm really excited to have Dr. Susy Hota joining us from Toronto, Canada. Dr. Hota, welcome to the podcast.
Thank you for having me. I'm very excited to be here.
So, tell us a little bit. You've had a history in being an infection preventionist in a large hospital system. Tell us how you've gotten to this point where you're at today.
So I actually started off my medical training in Toronto, and I wasn't really sure exactly what I wanted to do when it came to specializing. I knew internal medicine was where I was gravitating, but I did kind of take a bit of an adventure through gastroenterology and ultimately did end up in infectious diseases, and I loved it because it was so broad. And the aspect of infectious diseases that I loved the most was having that very sort of bird's eye view of what's happening. And I really enjoyed dealing with things like exposures when we would have a measles case come through or something, that required a large coordinated effort.
It's really interesting to see how world events, specifically these massive outbreaks, can really we can see a bump in the number of people who end up entering a certain field like infectious disease. It just shows how much the media can really pique interest into a topic and it can actually alter people's life choices.
You're absolutely right in that way. I think those are formative experiences, but it can go both ways, right? If this was not an area that was ultimately what I was destined to do, if you want to put it that way, it actually could have been a very informative experience in the other direction. I could have known, you know what, this is really not what I want to do. That experience solidified it in my mind, and it could turn you away from it because it's intense when you're in the middle of that. On the other hand, if it is something that appeals to you, it really does consolidate that understanding, doesn't it?
Yeah, no, I mean, it's very true. It gives you, whether you like it or not, the front experience of it. And with a field like infectious disease, I think the reason we keep on getting the bump whenever this happens is it's a field many people are not as familiar with until you get further into your medical career and you start to see the interplay between everything in infectious disease. So perhaps it gives that early experience that helps to create a pathway.
Yeah, absolutely.
Speaking of moments in time that create pathways, we just have emerged from the height of the pandemic over the last few years. And I know today we have a fascinating topic that is near and dear to my heart, burnout. And
Yes.
you've been dealing a lot with this being in the hospital system. All the physicians, nurses, healthcare workers in general have been impacted by that. We have seen burnout rates increase during the pandemic. But I have to say, for infection preventionists who probably were on the forefront of dealing with a lot of the tension and the stress and having to make these decisions, what has the impact been of the pandemic for burnout for you specifically?
I think this has been as you said, a grumbling issue for a long time prior to the pandemic. And some of that has to do with the way that we do healthcare nowadays
Mhm,
and some of the advances in technology which have helped us, but also introduce a need for large change management initiatives, right? And
mhm,
infection prevention and controls in the middle of all of this. We depend on things like our electronic health record as a really important surveillance tool. And we also work with the entire organization, every corner of the organization. And we have a unique role because we, like I said earlier, have a bit of a bird's eye view, and the policies that we set are really supposed to be applied for the greater good.
mhm,
But we recognize that sometimes that's at the expense of individuals who get caught up in that. Our patients are the system. Our patients are
mhm.
not necessarily the individual. So we have a lot of moral issues that we have to grapple with throughout, our time making decisions, and our decisions affect hundreds or thousands of people. So all of those issues that have contributed, I think, to burnout within the profession were there as we entered into the COVID-19 pandemic. And then having to accelerate the pace of our work, constantly evolve and adapt to what was going on, and of course, be in the hot seat, especially as leaders in infection prevention and control, where you're having to balance media interviews, messaging to the public, messaging to your own staff and your employees and your hospital or healthcare system, messaging to the clinicians, trying to deal with questions from patients and from other people as well. It's just a lot to be put in the hot seat constantly as things were changing. So these are the kinds of things that, from my experience, I did a lot of that. The media, a lot of the town halls that would get sometimes quite heated, around very controversial issues where we had little information to guide our responses. And you just have to have, I guess, a great degree of resiliency in order to get through that. That I felt a lot of internal support within my organization. That really helps when you're in a position of constantly being under scrutiny
Mhm.
by the public, and I think we're all familiar with some of the very uncollegial things that have happened over the course of the pandemic. But also because you're having to make these really high impact decisions that will affect lots of people, and there just simply wasn't the information there to make the kind of informed decision that you would normally like to make. So you're having to deal with that risk all the time. You really need to have the right culture to support it. That starts within your team, but it
Mhm.
also speaks to the larger, the leadership of your organization.
And even when an organization has good leadership, we still see that infection preventionists, even before the pandemic, there are always so many openings because
Mhm.
it's a hard job and it's a hard job to recruit for. And like you said, it's it's been only recent history that there really are specific training paths for infection preventionists. Tell me
Mhm.
about that outset in your own experience. Do you also see that same pattern with the institutions you've practiced in that it's hard to fill these slots?
It is and it isn't. So, first of all, I think that there's a difference between the infection preventionist role and some of the other team members that make up an infection prevention and control program or department. When it comes to infection preventionists, currently where I am, I think that there's enough interest that people apply to those roles. You just won't find people who are fully trained up. And so, we've taken very much the mindset in my organization that we're happy to accept people who are novice and really want to gain the experience, and we will support them in their learning and try to build that capacity up and ensure that, we're helping to fill the gaps that are currently in the system because there aren't very many certified people out there to recruit from. And that's a position we've taken for a very long time, and so we're quite comfortable with that. When it comes to other sort of epidemiologists who support the program, and then specifically the physicians are required to support the program, I think it's a lot harder to recruit to those positions. And some of it is because, typically we do come from the infectious diseases route. There are some shortages already that we're beginning with in infectious diseases, but also these events, like I said, around pandemics can either help or hinder that case, depending on what people experienced or saw when they're going through their training. Yeah.
So you talked about really being able to recruit widely as long as you're willing to do the training. Is there a goal or a certain ratio you try to aim for when you're trying to see how many infection preventionists specifically you need per hospital or for a system?
This is an excellent question because, there have been some traditional metrics that have been used, some
Mhm.
guidelines around, how many infection preventionists you should have, depending on how many hospital beds you have or how many patients you see, the volumes that you see. The
Mhm.
problem is that doesn't take into account complexity. And this is becoming increasingly important. As, like I had mentioned, we're changing the way we perform healthcare. So, it doesn't take into account the kinds of services, like highly specialized services you have. Do you have transplant patients that you see? Do you have oncology patients? How enriched are your patient populations for these higher risk groups? It doesn't take into
Mhm.
account what is your facility like? Is it a really old facility where you can run into infection prevention and control problems based on the infrastructure itself? And, other subtleties that we all know within the profession make or break your ability to actually keep up with the demands. There have been some efforts in this direction. The Association for Professionals in Infection Control, APIC, has put out just very recently a calculator that can be used to help people make a more informed decision around what the needs are for their organization. But it's hard for these things to then translate into a business case. That takes time to actually, get the resources you need for your program. And the other thing that we aren't very good at thinking about is how interrelated we are with the rest of the hospital. So it doesn't take into account, all the other individuals who are needed to support infection prevention and control programs outside of the department itself. And if you're deficient in those, you may need to have individuals within your own department to help with some of those other tasks. So a lot of subtleties go into understanding that. And I think this is where it becomes so challenging to fight, so to speak, for the resources that are truly needed for your program.
And then during the pandemic, I can imagine, I mean, you were there pre-pandemic, you saw how this program functioned, recruitment, training, everything. And then during the pandemic, it's a whole different beast. I mean, everybody had to go through training regardless of your experience. How did
Yes.
that impact the morale in your department? How did you see that impacting then retention?
So during the pandemic, our needs grew because we suddenly became involved in so much more. And of course, there was a
Mhm.
health emergency at our foot. So we did expand and recruit a number of people. And what worries me all the time is we have so many staff members now within the department who grew up, so to speak, within the pandemic, and that's what they know the best. And so the basic understanding of some of the other very common infection control issues, and then the less common, more rare things that are starting to reemerge, measles, all these other infections, we still need to build that capacity. So people are quite swayed by their experience with COVID-19. So we continue to work on that. I think those are not insurmountable problems. It's great that we still have really engaged people who've come on board. What I do find more difficult is, I may have alluded to this, but your infection prevention control program is far more than your department. It's the entire hospital that's part of that program. You're simply a department focused on it.
No, that makes complete sense. Did you find that it was easy to retain people throughout all of these transitions that are happening? Or has that been a challenge you're facing?
In our department, we've had less problem with retention, and that I feel very fortunate for. But it's not because of a lack of trying. Like we really do put a lot of conscious effort into ensuring we have the right culture in the department,
Mhm.
the right team dynamics. You have to invest a lot in keeping people happy, and the leadership really needs to set that tone as well for the department. So that's really helped us along. I mean, it hasn't always been that way. We've had some turnover before, but now when people choose to leave, it's often because they're getting a promotion somewhere else or there's a great opportunity elsewhere. And I see that as a success in itself. So retention's been great from the infection preventions on the prevention side. Where I do worry is, infectious diseases physicians. Again, this is like a recruitment issue, but also how do we retain them and keep this, going because of the specific issues around burnout in infection prevention and control.
Yes, and I mean, during the pandemic, there was a solid, I think, 2 years there where my significant other, we talked and he's like, "I don't think you've had a single day off because if you're not doing this, you're doing this, or you're doing this." And it wasn't necessarily always because of my main workplace, it was the other things that you do to help when you're part of a community that has no other resources to turn to.
I think what you're referring to a little bit here is some of the volunteer roles that we all took on in order
Mhm,
to support pandemic response when there is a shortage of not just infectious diseases physicians, but those especially trained in infection prevention and control, but also in public health physicians. We don't have enough of them. And so many of us wore multiple hats, and there is a lot of collaborative work that happened between those two groups here. And I think that's been a positive thing. But sitting and writing guidelines, best practices, and response, you know, guidance documents on different levels, regional, provincial, federal. Like, I mean, here we have lots of layers in how all of that rolls out. It was, I think, very impactful, and so you find that gratifying at the time. But now we're at a point where it's you've got to reevaluate the value of the work that you're doing, and one of the problems I find with the pandemic is everything turned into an emergency and everything turned into a high priority. So everything's high value. And
yeah,
you lose that ability to prioritize when everything is, at the same tier. And, you get accustomed to having to work at 200% all the time. So now we're at a point where I personally believe we need to roll back. We need to get back to something that's more sustainable. The
mhm,
emergency is over. Sure, the problem's not gone. We have lots of other
mhm,
problems to tackle,
mhm.
but we need to roll back and find something sustainable, or else we will have highly effective people working for a short time.
So you're exactly right. The sustainability issue is such an important thing when it comes to being at 100 all the time. That's not sustainable. What are some of the things that a system can do to help workers change that mindset?
I think the first thing is the leadership has to signal that it's okay to slow down and, put into place, if necessary, the policies around, work hours. And, there's a creep that can happen where meetings just start to suddenly appear again. And we've had some conversations here on like the proliferation of half-hour meetings that really should have been 1 hour meetings, which result then in follow-up meetings that are required to complete the work. And it just snowballs from there, right? And you're late for everything because it's gone over. And these all contribute to that feeling of the pace being unsustainable.
Mhm.
So I think there are some policies and some, I guess messaging that can come from the leadership of the institution that says, yeah, it's okay to slow down. And in fact, you should. And then it's a matter of mapping things out differently. So,
Mhm.
it's that whole concept of going slow to go fast. Like sometimes we're just going too fast all the time and it's not effective ultimately because you end up having overlapping projects and you're just not pacing it out correctly. So, I think mapping things out and as an organization, pulling out your strategy and understanding how to get to where you need to be in a way that's more sustainable. So that's very intentional work that again requires a leadership to really think through that. And then those who do the work will follow, right? I mean, I think we're all just kind of waiting for the okay that we can slow down a little bit and that vacations really should be vacations.
As you're talking, I just keep on thinking because so many of us were infection prevention or infectious disease or just in medicine and period end up being both the clinician side or the clinical side and then doing the research. And I'm
Yes.
just feeling so guilty as you're talking, thinking, yes, I've always been trained that you go on vacation. So now it's time to get out that paper that you've been meaning to write.
So I think in medicine, there's a slight difference to it as well, or an additional facet to it. We're very good at recognizing researchers, we're good at recognizing excellent teachers, and we're getting better at recognizing good quality improvers. But
Mhm,
we haven't recognized leaders in its own category. So, and leadership, it doesn't have to be that you have a
mhm.
specific leadership role, even, but if you're doing leadership related work, and a lot of the infection prevention work that we do as physicians falls in that category. It may not be evaluated in such a way that you can package it into a quality improvement, kind of initiative, but it is showing leadership that's really quite crucial. So, maybe over time we need to develop that stream of academic merit that's associated with leadership work. So you don't feel like you have to, in addition to it, churn out the papers and all that. It gets its own recognition.
What are some of the other contributors that you have seen that have contributed to the burnout that we see in healthcare spaces?
Well, one that we cannot necessarily change is patient volumes. So clinical volumes have increased
Mhm.
where I am, as at least. And so it's just busy. The workload has increased in general. And, at first it was a matter of, well, we've got backlogs that we haven't addressed. Now it's getting, I think, a little bit more into that. Well, because of the backlogs, we have lots of these, undealt with issues that are turning into bigger health problems in our population, and we have an aging population. And on top of all that, we have COVID on top, that wasn't there before. Oh, yes, and by the way, other respiratory viruses are behaving badly at the time, at the moment
Oh,
because
yeah.
of all these changes. So there's a confluence of these factors that are having a real impact on our volumes, and we just can't do anything about that. So I don't have a real solution around that. I think we just have to increase our capacity, invest more in healthcare, and we've got to be smarter with how we use our time. The next thing I've mentioned once already is technology, and I'm not anti-technology. I'm quite supportive of technological advances, but in infection prevention and control, and in healthcare in general, it comes with a bit of a price in the early stages. You've got to change people's work and their mindsets, and it's a shift. It's a really large shift, and that takes a lot of effort. So I think that having come out of a health crisis or an emergency, then having to change, electronic health records, change all kinds of systems, introduce robotics and other, advanced ways of delivering healthcare. It's necessary, but it comes with a cost.
So talking about burnout and leadership and the examples that you're setting, personally, what has been your lowest point where you felt like you really needed to take a step back, or maybe didn't even recognize in the moment, but later recognized, oh, wow, I was facing burnout?
So I'm not sure I've actually faced burnout itself because I
Mhm.
take that very seriously in terms of, how you quantify it, but certainly symptoms of it pop up absolutely. And for me, I'm one of these individuals who can work really well in a crisis. Like I probably thrive in under those conditions in some ways, which, I'm not sure what that says about me, but I work well in that situation. It's
Great
the
critical care
after
job.
It's the after, events that then allow you to have the time to reflect maybe and recognize that, wow, I need a bit of a break. And so, after the sort of height of the pandemic and the Omicron, um, whatever we want to call that, it's not an incident, the times. I noticed at some point when things had quieted down with COVID-19, there's questions that would still arise around masking policies, and I saw myself just kind of doing the internal eye roll. And to me, that was a signal like, "Oh gosh, here we go again. More questions about this again." And when you start to feel like things are really repetitive, it's like, I found that really difficult. I just didn't want to have to answer the questions again. And that was, I needed a break.
What is your highest moment where you just felt like, hey, I am really on the ball. I've been taking care of myself. I've been doing the things that really enable me to do the work and feel that love for it I always have felt.
I think part of it is feeling really gratified in the work that you're doing, feeling like you're really contributing and that your work is meaningful. That's part of it. But also at a point where you're not so overworked that you can still look after yourself and do the things that you enjoy doing. And that includes, being physically well and taking care of your physical health. It means being able to spend time with the people you want to spend time with. It means being able to sleep well. And definitely, I've had actually, multiple points in my career where I felt like I hit that sweet spot. Now, the sweet spot always is a sweet spot because something else comes in and
Mhm.
encroaches on it and you have to respond to it. But I do think as long as you have those moments throughout
Yes.
your career and your life, you can continue. It it
Mhm.
it persists. I guess it fuels you for the next time that, you might feel like, "Ooh, I need a bit of a break," and then you remember, "Ah, I can do this. I can get to that sweet spot again."
And I still remember in residency, it was kind of a joke amongst us residents that we were being told how to prevent burnout by getting a 1 hour lecture telling us that we needed more sleep.
Yeah.
And we all would sit there and think, well, can we just use this hour to sleep instead? We know we need more sleep.
And let me
So
guess, that lecture was at 7 AM or right?
yes, it
Yeah.
was. It totally was. And so it's one of those things where we always say resilience is the answer to burnout. And then it gets put onto the individual onus of the healthcare worker who is already so overburdened when even if you have a very supportive system, it's really the overall structure that needs to have solutions embedded into it to
Yes.
actually create that internal systemic resilience rather than putting it as another to do on that overworked person. How do you create a system that has that is better built to be resilient in itself to then support people in this journey?
Well, some of it is, we're having the right policies and procedures in place, sorry, to allow people to then pursue those individual strategies for building resilience. Because you're right, some of it, it is up to the individual, and you have to choose to do these things that will maintain or build up your resiliency. But of course, if you're not enabled because your organization is putting barriers in the place, that's never going to happen. So that's part of it. The other part of it is a bit you have to wrap your head around it, but having sort of a learning mindset. So, we just talked about lectures and how that can impact on your ability to actually have some resiliency. Yeah, but sometimes when you're learning something you're truly engaged in and it feels like it's advancing you either in your career or even personally, then you want to do it. You want to partake in it. And I think that's important. So offering that kind of a mindset as an organization helps to shift the culture, but also it sort of breeds people who do like to question and evaluate everything along the way and improves the quality of actually deliver our healthcare. So it's a win-win, really. So that learning mindset is really key to it. And then recognizing that none of us are in this alone. And so if your organization offers supports and resources, or even if you have to look outside of your organization for the supports and resources for you to do your job well or to be able to figure out how to have harmony between your work and your life, outside of it, then I would encourage everyone to take advantage of those.
Yeah, I have to say that was one thing that I truly appreciate in residency. I didn't have many friends in other programs that had this experience. So I think it was unique at the time, at least to my program.
Mhm.
And I hope more programs are doing this, but we had every week a one of our faculty that was trained in burnout, resiliency, in coaching, and mental health would come and do a support group that was a completely confidential support group that we had our lunch blocked out. Somebody, one of our peers that was not in our class, so either below or above us, would carry our pager so we couldn't be paged on patients, and everybody had to attend, even if you didn't contribute. And it just created, it fostered this spirit where, okay, I'm facing this problem, but so are you, and so are you. And it helps to really overcome some of these challenges.
I think that's a great example. I never had that in medical school or through residency. I will say in infection prevention and control, because there's such a
Mhm,
small number of us physicians who do it,
mhm,
and it's such a unique little niche, we actually have grown pretty close. And some of that started before the pandemic, as there are a number of us in our cohort who are around the same stage of training and career development. And we realized like you're kind of flying blind on a lot of the decisions you have to make. There wasn't a lot of evidence base
mhm.
for much of it, and so we realized we needed to rely on one another. And so we did. We kind of developed those relationships, and that really helped us. We had to deal with COVID-19. And even now we still have like communities of practice that we use. And it's not just the community practice. It is an opportunity for people to share some of their experiences and get that support from their peers. Because it's a kind of support that you're not going to get from your leadership, not even from your mentors or any other allies you have. It's really quite specific to what you do. So
Mhm.
yeah, it's great when you can find that network.
That's really awesome. What are some of the external resources that you've recommended to people if they're facing burnout or that you know of that people could utilize if they're hearing this and they're like, hey, this strikes a chord. I would love to know how I can get more of these resources.
Yeah, I think, reaching out locally in your university or your health system will help you to find some more local resources. But broader than that, there's the Society for Healthcare Epidemiologists for
Mhm.
America, there is the Association for Professionals in Infection Control, APIC. All of these organizations are there for this and have resources embedded. So check out their websites. They also have listservs and groups of people. And if you do choose, I would encourage you to go to the conferences now that, they're up and functioning fully in person. It's a great way to network and meet people. And you'll find lots of like-minded individuals there. And many of them have mentorship breakfasts and groups and initiatives. And so that's a great way to actually find, again, people at the same level of training as you, but also people who've been through it before and can offer some sage advice.
That's really great. And I know that it's not infection prevention specific, but the AMA, the American Medical Association, they also have a really great toolkit on burnout that anybody can access. Do not have to be a member of the American Medical Association. And it's just on their website. They have multiple different toolkits. And if you Google AMA burnout, it will pop up. So that's another
That's
one that
really
I
great.
know. Any parting words? I mean, you have been such a light on trying to share how we can prevent it and how we can embed our systems and empower our people. If you were to leave one message, what would you want to say?
I think my biggest message is to work together on this. We need to lean on one another, and that's how you can get through these kinds of difficult times. We don't have control over everything that's going to happen in our profession or in the world around us, and so really just focusing on the team and helping each other. That's really your best, I guess, navigator out of these more challenging times.
Stories of Care is a publication of the AMA and CDC's Project First Line. Project First Line is a national infection control training collaborative working to provide all healthcare professionals with the foundational infection control knowledge they need and deserve to protect themselves, their patients, their coworkers, and their communities. For more information, trainings, and other infection control resources, visit cdc.gov/Project First Line and amafirstline.org.